I'm Erica Lackey, and I am a licensed professional counselor here at Hope Health. I ended up into behavioral health because I used to work in the school system, and I had a situation where I was able to become a counselor in the schools, and I did that for 8 years before I went into private practice. And I wanted to work with individuals so that they could feel seen and heard and understood. That was generally the theme that I would find when I was working in the schools. People just want to be seen, they want to be heard, and they want to feel like people are really listening to them and understand where they're coming from. So I like working at Hope Health because we provide services for the whole patient. And so it is not just mental health care, it is also their dental care, their women's health needs, their medical needs. And a lot of times all of those things go together, including our mental health. And so we can actually serve the whole patient rather than just parts of the patient. So for example, when I was working in private practice, we talk about those things because they're important to us in our life when we have medical issues going on. But the nice thing is we can do collaborative care here, whereas there it's like, this is what you should probably talk to your doctor about and whatnot. And we can help kind of smooth that and build a bridge so we're able to collaborate with the providers on behalf of clients or with clients. And that's just a perfect part of what we do. So my practice philosophy in behavioral health is listening. That is the key point to start with, and tailoring things around exactly what that person is looking for, what they need, what they're hoping to achieve, and what kind of guidance do they feel like they need to build some of the skills that they need to cope with different life situations or just things that have happened in the past that have affected them in current day. I work with children all the way up to older adults, and there's similarities between everybody. You know, everybody wants to feel heard. They want to feel seen. They want to feel like this issue to them is valid, and how does it work to find a solution to where they need to go. And I find that most often when you're tailoring an approach to somebody, they get exactly what they need out of it. And so I'm pretty eclectic. I have a few different modalities that I'm trained in and that I can use in what I do in a session. And so I am EMDR trained, and so I can provide EMDR therapy to patients, which is a trauma-focused care. I can also use some solution-focused. If you're having a problem right then and there, we can kind of problem shoot that and see, okay, what's going on? Where are you feeling misunderstood, or what do you need help with to help guide you? And helping you develop those skills to be able to find the solution for that. Also, we do cognitive behavioral therapy and dialectical behavioral therapy, and some different modalities to best serve that person, because it needs to be about you, not about us as a professional. The whole goal is to serve you. If you are an established patient at Hope Health, you can ask your doctor for a referral, or you can see us at the behavioral health desk and we can help set that up for you to get that referral process going. If you're not an established patient with Hope Health, then you can go to the website and click on to register for a new patient, or you can call up and we can help you with that process either with paper or online to get you set up as an established patient at Hope Health.